Okay, so as you assess things on yourself, you're going to look at opening. What's the total amount of opening? Is there pain? Is there excessive tension or stress? Then we're going to look at opening on the diagonal. It's more of a motor control assessment. Is one side more smooth than the other or more effort? Now we're going to look at lateral deviation. Is one side more restricted than the other? And you can see there my right side going to the right is more restricted. Right, now we're getting on the joint surface. We're on the anterior surface. As we open, does one side move forward first or furthest? That would be the side that you would want to mobilize on yourself before we then get into the ear canal here, and we're feeling as we close the mouth, is there one side that moves excessively posteriorly? So I'm going to take you guys on a quick tour of how I have been treating my own TMD. And I'm going to be more thorough than what I do on myself because I need certain things and I want you to have all the tools that you need to help yourself. So first muscle we're going to go to is the temporalis muscle, right up in this area. And the muscle belly kind of runs up and down here. So I want you to kind of go forward and back to try and figure out where in your temporalis do you have a restriction? And for me, right here on this right side, I have a restriction moving posteriorly. All right, and so to localize that a little bit further, I want to check, is it kind of down and back or is it kind of up and back? And it's actually a little bit more down and back in this direction. For you, it may be that it is relatively forward or relatively in this direction. So you kind of want to imagine a clock and figure out which direction is most restricted. All right, and I want you to do this really on every muscle that we get on. I'm not going to walk you through that on every muscle, but just know that's my assessment of which direction I need to go. So I am pulling down and back on my temporalis. Now from here, I could just do breathing. Okay, I could do little chin tucks, or thinking about elongating the back of my neck. Okay, I could also do opening of my mouth. All right, and as I open, I actually feel more pressure that goes into my finger. So I'm going to keep sustaining that opening. All right, and just go on pressure, off pressure there. Okay, I could do a little gentle clench because it is a clenching muscle, so I could clench. And I could combine the clenching with opening. Okay, so that's just to give you an idea on all of these different muscles. We're not going to go through every option on every muscle, but on the temporalis, I just want to give you an idea. Now to go through a few other muscles that I think would be helpful for you is we're going to get to masseter here. All right, so masseter is all in this area here. It's your main muscle of mastication or chewing muscle, and you just want to get a general idea which side feels more restricted. For me, my right side feels more restricted, and is it more going back or is it more going forward? It's more going forward. And then here, just figuring out the tightest infeel, what makes it the absolute tightest area, what makes it the tightest, hold it down, and then I have those same options. Okay, so working through masseter. All right, you can hang out there for 2 or 3 minutes, just depending on how long it takes to work through that muscle. You can also find other areas because chances are it's more than just one area, but if you work on the most restricted area first, hopefully that's going to give you the most bang for your buck. All right, so that's masseter. Now we're going to go into the medial pterygoid muscle. All right, so medial pterygoid, if you go right at the angle of the mandible here and dive just underneath that on both sides and then go up along the inside of that, you'll find the medial pterygoid. All right, so on my right side, I am most restricted. I found the best way to mobilize this is you can do it with opening, keeping your tongue on the roof of your mouth. But what I found the most beneficial here is actually doing lateral deviation the opposite direction. Okay, so that's working on medial pterygoid. Now to work on lateral pterygoid, I'm actually going to take my pinky finger, make sure your hands are clean, and you're going to slide up basically along the outside of your molars up towards that joint line up here. And you're going to run into a muscle kind of right at this level that just feels, if it's dysfunctional, it's going to feel really tight like a band. Okay, so I'm going to go ahead and do that. And again, that's another one you can do opening. That lateral deviation is a really good movement to do to kind of further engage that barrier. If it's too tight, too tender, it may help to actually do deviation towards that same side so that it's not overly tender for you. You shouldn't be killing yourself while you're doing these exercises. All right, so that is lateral pterygoid. And another structure that I did not show whenever I was treating Keeley, but I do on myself that I feel like is really beneficial, is an ear pull. All right, so the ear has different fascial connections to that TMJ. And so if you get on your ears and you kind of pull on different angles like a clock, you can feel which direction is the most restricted. And for me, it's kind of down and back on this angle. I could take up that slack and then move my jaw in different directions. So I could open. Okay, I could open on a diagonal. All right, I could clench, and that doesn't really do anything for me. Or I could protrude my jaw forward, which I get a really big pull whenever I do that. And then I'm actually coupling that with a little bit of rotation of my head away to the left, and that gives me the best pull there. Okay, and so that's something that you can play around with too and see my right side actually already feels significantly looser than the left side. So that's the ear pull. And now we'll move into more of the joint specific mobilization. One that I've found that patients can do on themselves very effectively is distracting the jaw joint down and away. Okay, so in order to do that, you come just in front of the ear and you can kind of skin lock down on that joint. All right, and the same thing on the other side. And I want to feel as I open which side has a harder infeel. And typically these are patients that I'm giving this exercise to, so I'm able to tell them exactly which side they need to work on. But just kind of see if you can feel as you open, if there's one side that feels more restricted, or even if you get clicking on one side, if kind of stabilizing that side in distraction is actually helpful for you. Okay, so for me, I feel this left side is a little restricted. So I'm going to keep the tongue on the roof of my mouth and open. And I'm only opening to the point where I feel like it doesn't want to distract anymore. Okay, so I'm kind of engaging what puts pressure into my fingers there. So I'm pushing down in this direction and opening right there and close and opening, and I could kind of open and close going on pressure, off pressure to mobilize that. So that is the joint distraction technique. And finally, for those of you that have excessive anterior or forward translation of that condyle with opening, you can block that condyle from coming forward. And this is going to be a really small motion with your opening with your mouth, because chances are those of you that translate forward, it happens really early in that range of motion. So when I open, I feel excessive anterior translation on that right side right away. So I'm getting just in front of that condyle and blocking it back, all right? So that then whenever I open, right there, it wants to translate forward and I'm blocking it. And then I'll just go on pressure, off pressure, and I'll just show you what a few of those look like. Okay, so I was taking my left hand and kind of stabilizing the left side because it tends to get all wonky if you don't control as many variables as possible. So something that's really important after the mobilization phase is the re-education phase in functional manual therapy. So with the jaw, what we want to do is get the jaw into the position that it is able to maintain its efficiency, and as soon as it starts to go kind of off course, we want to do a prolonged hold in that position. So for me, I'm going to start with my tongue on the roof of the mouth and open. Okay, and I will do a 30-second hold in that position where my jaw wants to start to deviate. And then from there, I would do what's called a combination of isotonics, or I'll do a little resisted opening and closing in that position. So I'll just show you a little bit of what that looks like. Okay, so I'll do 10 of those repetitions. And then I can also challenge myself to do the opening on the diagonals. Okay, so I could do 10 either direction on that in front of a mirror, trying to make sure that I have that diagonal as smooth as possible. And then I could add a little bit, not very much, but maybe 2 out of 10 effort on an effort scale of putting a little bit of resistance into my jaw. Tongue stays on the rugae on the roof of the mouth. Okay, just working on a diagonal for me down and to the right, and then a diagonal down and to the left. And then the last thing that I like to do is just generally getting the head and neck more stable so that the jaw will inherently be more stable. So with this, I put the tongue on the roof of my mouth on the rugae again. I'll then make sure that I'm in a good postural position. I'll bring one hand to the back of my neck. The other fist will come right underneath my chin. Now with this, I don't want my chin to be jutting forward. I want to keep that length in the back of my neck, fist under the chin, and then I'm going to resist that position. Okay, so my hands are trying to take me out of that position, but it's really an isometric, so no movement is happening at all. All right, so that exercise is turning on some stabilizers in the neck on the back, as well as some stabilizers on the front, while I have the tongue on the roof of the mouth, which is also going to help with jaw stability. I typically hold that for about 30 seconds and do it twice. All right, so that's it. That's the self-mobilization series of the TMJ. Hopefully this was helpful for you. Hopefully you have some more motion when you redo those pre-tests. If you need further help, further assistance with managing this area while we're still in the middle of this pandemic and still wearing masks, feel free, reach out to me or reach out to a therapist in your area who has experience working on TMD. The self-mobilizations are great, and many of you will be able to fully manage your TMD with just the self-mobilization. But if you need help, please reach out. There's people that are ready and willing to help you during this time. So thanks for watching, and wish you the best in managing your TMD.